Well, hello. Welcome to Empowered by Beauty. Marisa Faircloth here at Restoration Med Spa. I'm Lora Songster, and we want to talk today about skinclusivity. Because not all skin is the same, and you need to treat it as such.
You are absolutely right. Different, we call them Fitzpatrick. Dr. Fitzpatrick was one of the leaders in dermatology that really categorized skin based on its melanin level. So that would be the color of your skin. So it reacts differently. This is something that makes a big difference when you're choosing a med spa. You need to choose a med spa that has the ability to treat different types of skin. Lasers are typically going to be heat based, and melanin or pigment in your skin absorbs the heat. Like if you wear a dark colored clothing, you're going to feel hotter than if you wear white clothing. So the darkness actually absorbs that pigment. So when that, absorbs the heat, sorry. When that occurs, that means that you are heating the skin more. You have a lot more ability to burn the skin and create damage. So if you are seeking out laser services and you have darker skin types, you do need to be careful about choosing a practice that has those appropriate devices.
And just for people who may not understand that, and I may be one of them, um, so you would treat me differently than a Hispanic or an African American based on the lightness or the darker that they are.
Absolutely. So someone like you with blonde hair, blue eyes, fair skin, you have a very low melanin level in your skin. So when I'm using a laser, if that melanin is what's absorbing the heat, you don't have a lot of that happening. I can use a laser that is much more aggressive on you. But someone who has a lot of pigment in their skin, if we're overheating that pigment, we can potentially create scarring by creating darker pigment, burning the skin. We have to treat that appropriately. And that either means having a laser that you can adjust the settings appropriately, or sometimes even different lasers. Back in the day, when we first started with lasers, we didn't have any lasers that were capable of that. There are different lasers now that give us a lot more widespread capability. We do have multiple of those lasers. But I know that I've also seen a lot of patients who have been treated improperly because med spas incorrectly tell them, oh, sure, we can treat anybody.
Well, that's very short-sighted, and you should, especially with your face, your body, you need to do your research.
Absolutely.
And one of the things I am often commending you on is you invest in your practice, because that's investing in your clientele, and everyone, you want to walk out and tell their friends how great
Absolutely.
they look, how great they feel, and that takes capital
It
to
does.
buy,
It
several
does.
lasers instead of one, crossing your fingers. So when you are doing these kind of procedures, you want to make sure that you've done your research. And Marisa's got the latest and greatest technology.
We've got it all, but we have things that lasers like Aerolase. And Aerolase has a much quicker pulse width. And what that means is, think about a hot stove. It never feels good to put your hand on a hot stove, but if you put your finger on it and quickly take it away, you don't have the opportunity to have created enough damage with that heat. If you put your hand there and hold it there, you are going to create significantly more damage. So with a laser that is able to create a really quick delivery, it shoots the heat out and stops. So the heat can do what we want it to do without lingering and heating up the surrounding tissue. That would be something like Aerolase. So we are able to get the kind of results with Aerolase that we might have gotten with other lasers much more safely.
And is there an age for that? Is that something you would want to do in your 30s or your 40s, or is it just dependent upon the client?
And it depends on what you're looking for. So Airlace is one of those devices that literally has 93 FDA indications.
And
Depends on what you want. Are you treating it because you have brown spots from sun damage? Are you treating it because you want to build collagen? I think laser treatments are great at all ages. All of us, once we reach 30, which that seems sad that 30 is the peak. That was a long time ago. Honestly, at 20, you start diminishing how much collagen you're producing. So once you reach 30, you not only are producing less collagen, now all of a sudden you're breaking down the good collagen that you did have. So in my practice, I think everybody needs to start filling up the bank. You know, it's like having a bathtub with a leak. You know, you can have a bathtub with a leak and it's gradually seeping out, but if you got the water still running, you can at least keep it level, and that's our goal. We want to keep it level, if not adding a little bit more to the bank. So as your body is diminishing that collagen, and with that, that creates thinner skin that loses elasticity. Now you're seeing more wrinkles. You're seeing that you're losing that nice snap and thickness to your skin. So building up that collagen level is going to replace that collagen that you're losing. I think people have the misconception that you do a laser once and that fixes it forever. Well, you didn't patch the leak. You know, you are still losing collagen, so you have to build as much as you're losing. So I think it's great to start doing a little bit of low-level lasers early, because you build up that bank where your skin is even thicker and healthier and more elastic, that as you're diminishing that, it isn't diminishing to a point that it's visible.
Now, I'd be curious. I know there's liquid collagen. You can take supplements for collagen. Is this a more efficient, faster, longer lasting? Where does this stand?
This is my analogy.
Okay.
It's the best one I've come up with. You can dig a swimming pool with a backhoe, or you can dig it with a spoon. Is it impossible? No. You could dig a swimming pool with a spoon, but you are doing so little with each time you're doing that it's going to take forever. It does not mean that the things that you're doing at home are doing nothing. But alone, they're not doing enough to make a big impact. It's like 1 or 2 drips a day. Is it better than not doing it? Of course it is. But it isn't impactful enough. You are getting so much more benefit out of laser-based, heat-based treatments that are really building up that bank. Does that mean that you shouldn't do those at home? Of course you can. Do the things that you do to maintain. I think those are just bonus. But they're so minimal, they're not going to make a huge difference.
Well, I think that's a great analogy, because
I like it.
We'd like
Best one I can come up with.
We'd like to think we're doing what we can, but it's also great to get the information that there is more and more effective ways to feel better about yourself and feel about your skin.
It's like skincare. Of course you should use good skincare, but using one good cream is not comparable to doing a laser treatment, because you don't have the magnitude of collagen that it builds. So when we're doing a laser treatment, we're creating a controlled thermal injury. So every time you have an injury, your body runs to the defense, lays down collagen to heal. So what we're doing is we're tricking our body to create that healing response and build more collagen. And that's going to give you a whole lot more than just the routine little things that you're doing. And my goal when I see a new patient, depends on where you are. You know, where are you starting? Are you starting at 35 and you're scared that you're going to start seeing aging and you see little minimal changes? Or are you 65 and you are a sun worshiper and we have a lot of damage to compensate for? I think you should go to the biggest treatment that gets you the result that you want to see. So if you come in and you're young and you've been taking good care of your skin, we can start with something low level. We can start with a little baby device that gives you just a little bit of collagen boost, and you're going to see benefit, and it's going to be great for you. But if you've not done anything for years and years and you see a lot more damage, it doesn't mean that that treatment won't be beneficial, but that degree of improvement isn't going to let you see the results you want to see. You need to get a little bit more aggressive.
I really like the thought of tricking your body into healing itself
Yeah.
and creating more. Because goodness knows our body has played tricks on us over the
No
years.
fooling. It's always good to get back at it.
So we talked about Aerolase. What other kind of lasers do you have?
So we have not just lasers, but a lot of different devices. So Aerolase happens to be one that is for all skin types. We have some other ones that, because of the way that they work, they land a lot more heat into that melanin level or pigment level of your skin that isn't always safe for all skin types. So we do have lasers like Moxie, which is a relatively low-level laser, and what that means to you, the patient, is that you don't have a lot of inconvenience. It's not really inconvenient to do because it isn't that uncomfortable. It doesn't have a long recovery. It also means that what you benefit is a little bit less. We're going to do that in a series. So with Moxie, you may be a little red and flushed and feel like you have a mild sunburn, maybe for a day, but the next day you're going to feel fine. After that, you may notice that your skin feels a little dry and rough as it's healing, but that isn't anything that's going to inconvenience your lifestyle. You can put them on your makeup, you can go to work, you don't have to worry about hiding in the house. And you will have to come back for a series. We would do a series of 3, and each time you are building that result, so you're seeing your skin get a little better and a little better and a little better. Now, we can jump to a more aggressive laser like Halo, which definitely will give you more result, but it's because we created a bigger injury and your body kicks in more. And what that means is you got more recovery. So now, yes, it's going to feel like a bad sunburn. You might have some swelling. It may take 2, 3, 4 days for you to feel like, okay, I feel okay to go out. I'm not uncomfortable that I'm swollen and I'm red. But when you do recover, the amount of improvement you're going to see is going to be dramatically more than if you did a little entry-level laser. So if you were coming in and you're 30 and you have minimal damage, I'm not going to recommend you do that. You can do the little entry-level ones. You will still see nice improvement, and you won't have to worry about your lifestyle. Right. If you come in with more damage, you have a choice. You know, we can work on this over time. Not a spoon, maybe a bigger implement. Get there a little bit at a time. It will take longer to get to your result, but it also depends on our patient. You know, we do a customized treatment plan. When we have somebody come in, we want to know, what are you looking for? Are you somebody who travels all the time and you're gone for days at a time, but then when you come home, you have a week that you work from home and you don't care? Or are you somebody that week of downtime means that you have to take days off work and you would rather come in 4 times and do it rather than take days off work. There isn't a right or wrong answer, which fortunately or unfortunately is why we have so many devices. We are not the practice that says, this is what we have, this is what we're doing. Our goal is that we cater that to you and what your lifestyle is and what your goals are.
Well, again, having a multitude of options and knowing that, as you say, I have one day I can be a little rosy in the face, or can I take these 4 days?
Mm-hmm.
Do I have any video calls, or am I working at home? And to have those options and be able to lay them out for the client is so important.
I think that, unfortunately, our industry is not good at that. My background's in surgery, and surgeons tend to feel like you came for surgery. This is what it is. They, in general, undereducate their patient. And being in those practices, I tended to be the person that got the phone calls afterwards. And most of the things that people were calling about were actually normal reactions. They were things that, this is part of the healing process. Yes, you're going to be swollen for this amount of time. Yeah, you can't go to work for this amount of time. You can't work out for that amount of time. But sometimes patients aren't prepared for that ahead of time, and then it's a catastrophe because they're like, what do you mean I can't? I'm not going to be okay to go to work tomorrow. Well, no, you had surgery.
We discussed this.
And I think for us, making sure that our patient has realistic expectations of what their recovery will be, and we have realistic expectations of what do they need in their lifestyle so that we can help pair that better, so that we don't have patients that come back and go, I had no idea I was going to be swollen for 2 weeks. I mean, we do Cabela. We've talked about that before. Patients have swelling. I have patients who come to me who are getting married next week. Oh, I want to do Cabela for that. I'm like,
No.
bad idea.
You're really not going to like that.
I mean, even if they're doing injectables, I always tell my patients, the patient with the biggest reaction is the patient with the biggest event. If you have something coming
It's
up,
a Murphy's Law kind of thing. Yeah.
I could inject 20 people and no one bruise. If you have a big event 2 days from now, I can guarantee you you're going to have the worst bruise. Please don't do that. Prepare for what you're going to do. And most of the things that we do have low incidence of recovery. Nothing zero. There's never a guarantee that you're never going to get a bruise. And unfortunately, after doing this for over 40 years, again, the person with the biggest event is the one most at risk. So plan accordingly, and we can help you plan that. We can help you with your timeline. We can help you decide what's appropriate for now. What do we want to wait till later? You know, there are some people who are going on vacation and they don't mind doing a laser before they go because they're like, I'm not going to know anybody. I don't care. And other people, that would be the end of the world if that occurred during their vacation. So part of it is knowing the patient and what they're looking for.
Well, and the transparency of it all.
Mm-hmm.
Because if it's a first-time client coming to you, you're going to spend a lot of time and maybe get a game plan and find out what the goals are and all the things that you do. And give, we have this, and this, and explain all of that.
And that's overwhelming.
It is overwhelming, but once you're a client here, as I am, I just say, what do you think? Because I know that you've done your research. I know that you do your continuing ed. I know you have the latest, greatest implements. I'm not exactly sure. Equipment.
Devices.
I'm sorry.
Toys.
The
Depends
jargon,
on-
but toys.
Anna calls them her toys, but
And it's
you know.
important not just to sit there and go, If you have questions, you need to ask the provider.
Absolutely. And not every device is perfect for every patient. It depends on what your goals are. You know, if your goals are fine lines and wrinkles, okay, this device will be great, low downtime, you can do this. But what if you came to me and said, yeah, I don't like those fine lines and wrinkles, but I also don't like these brown spots, and I'm also more worried about my texture. Okay, now we have different devices that do different things, and our goal is to be a good steward of your money. We could say, you need a laser for the texture, we're going to do this for tightening, we're going to do that for pigment, and now all of a sudden you've had to buy 3 packages. We happen to have a device that does it all. Okay, that's a better device for you to do if that's what your goals are. And our goal is going to pair you with what's going to give you the best result based on what you're looking for.
I think that's so important when you're looking at cost. And
this is an investment.
It is an investment, and knowing that you're going to say, okay, if you have this much, here's what we can do.
Right.
Down the road, if something else is available, or you have other needs, or want to put a little more money towards it, we can do something else. But I think you're right. In a lot of instances, you go on a car lot, or you go, they're upselling, and
you're right.
That's only good if money were not an issue. And there are probably very few people who
Very few. But when I'm
Mm-hmm.
talking to a patient, I do say that. I say, okay, here's the money is no option plan.
Mm-hmm.
These are all the things that I would recommend. And if money is no option, I say do them all. If money is an option and we have to decide, then we have to categorize and we have to prioritize.
Mm-hmm.
We have to decide, what is your number one concern? What bothers you the most, and what would make you feel the best if you woke up tomorrow and that problem's gone? That's what we tackle first. Now, some of these things are ongoing. We need maintenance. Almost nothing is a one-time fix. But some problems are. There are some things that we can do, and we can fix that, and we can say, okay, we can cross this one off the list, and what are we going to tackle next? So it can be a progression. It doesn't have to be you're going to walk in and do everything under the sun, but it's like everything else. It's like coloring our hair and painting our nails and just making ourselves look presentable every day. It's ongoing. There is almost nothing that we can tell you, do this one laser and you never have to come back.
Yeah. And after meeting, you have a very comprehensive website that talks about your various devices there. I got that right. And you've spent a lot of time and a lot of capital making sure that information is there, because a lot of times we're in let's say a doctor's office, and you're hearing it, and you may forget to self-advocate, and then you get in the car, and then you're thinking about dinner. What did she say about that? And to be able to have that reference point, to go to the website, go, oh, yeah, that was the halo she was talking about.
So we have that, and frankly, I'm more concerned with outcomes than which device, because I think devices are great. There's no question that there are good devices and bad devices, but the same device in different hands will get you a different outcome. So a lot of times it is your provider, but we do want you to have good information, and we want you to know that what we're using is credible and it is a good device. But we also want you to have the information to take home. So when you come for a consult, we're going to have a comprehensive consult. We're going to talk about all the things that are available, knowing that when you get home, you're not going to remember all that. So we're going to give you written information. So when you leave, you're going to get a folder, a Restoration Med Spa folder. In that folder, there's going to be a letter of introduction with a picture of myself, my bio, my providers, so that you can see who are the providers that are going to be performing these treatments that you choose to do. We're also going to include in there a written quote of whatever things we talked to you and recommended, as well as brochures and information on each of those things. Because I might have mentioned Moxie and Halo and Silfirm radiofrequency microneedling, and you may get home and go, which one was what? I don't expect you to remember that, but if I can give you a written quote, these are the 3 options we talked about, this is the price of each one, here's a brochure of each one. Maybe that will put it together a little bit better. And then we're available afterwards. We are not high-pressure salesmen. We don't expect that every patient is going to walk in the first day and go, okay, I'm going to do everything. This is a big step. We expect you to do some research. We want you to do some research. We prefer that you feel confident when you come in and do your procedure, that you know that we are going to give you a good outcome. We want to know that you took your time to do that. So we're going to take our time to give you the right information. So I get it. You're not going to remember all that. But hopefully we give you enough information to take home with you that you can remember that. And everything, and people say, well, when I call back, how did they know what to book me for? It's in our file. We write down what we told you. It's written in the quote. So when you talk to one of our medical concierge, or if you talk to Jennifer, who handles a lot of our patient scheduling, she can say, Marisa recommended A, B, and C. What do you want to do? We already know all that. So we try to give you all the information that you need, but also provide you with the opportunity to ask.
And you mentioned this earlier, not all providers are equal. And we see you on billboards, we see you in magazines, we see you on the side of a van, and you've been a staple in this community for a very long time. And I would say those are all great marketing things, but the best marketing is me.
I agree.
Maybe not me specifically.
We love you.
But a client, and you had an open house, and I was here with 2 of my friends, New York City, and she said, wow, she is really, really good. and just, wow, you look good, or your cheekbones, and today, well, it's Marisa, Restoration Med Spa, Powered by Beauty, that's what she does. And to have that word of mouth and so many positive outcomes and happy clients, it's not in the yellow pages. You can't read it that way.
But it pains me that people come in for consults and all the time I hear, wow, no one ever told me all that. And I'm like, you paid the money and did something and they didn't tell you that? Because they don't take the time. And you deserve that as a patient. You deserve to make an educated choice. I can tell you the options that I think are good, but different options are better for different people. And that is your choice as to, do I want a week of downtime? That might interfere with my life. That might mean I have to take a week of vacation. That's going to dramatically change my overall cost of having this done. We don't want to do that. I don't want to push you into a procedure that I think you should have if that's not the best one for you. So that just means taking time. So that means we need to take the time to educate you. But as a patient, you need to take the time to find that right practice because your expectations are going to be met when your provider knows what you
Right.
really want and you know what that treatment is really going to provide for you. I have people all the time say, well, I did that. It didn't work. And I said, what did you think it was going to do? And possibly they're coming in, I'm making up stuff, but like they may be coming in going, I did microneedling. And they said it was going to take away all my wrinkles. I was like, well, it won't.
That's false advertising.
That's the wrong
Yeah.
procedure. Their expectations didn't line up with what they spent money on.
So it is important to educate yourself and go to a provider like Marisa, who wins tons of awards all over the nation and blah, blah, blah. But
That's why I hang with people like her.
That's right.
She's awesome.
But it comes down to personal happiness and satisfaction and getting compliments. I mean, who doesn't love that? Right?
Absolutely.
It's Empowered by Beauty. Marisa Faircloth here at Restoration Med Spa. I'm Lora Songster. Join us again.